And almost instantaneously after the concert ended, she experienced clogging in her ears, she had ringing in her ears, really kind of expected it to go away, and it never went away. She could not tolerate even having 3 or 4 people having a conversation around the dinner table. And so I intervened very quickly with sound therapy, and slowly, she started to be able to experience different environments with less discomfort. And to your point, she didn't always notice it. She would come in and she'd say, I'm still really bothered, but she would also tell me, hey, I was able to go to this restaurant. And I would say, "Hey, you weren't able to do that in the beginning." So it's a testament to, us being on this side and being able to guide somebody and also point out their successes when it may not be as obvious to them.
Today we're joined by Dr. Diana Vetere, one of the newest audiologists on the Treble Health team. Dr. Vetere brings a wealth of experience in managing tinnitus and sound sensitivity conditions like hyperacusis and misophonia. In this episode, we'll be discussing her approach to treating patients with tinnitus and sound sensitivities and the tools she finds most effective. We'll also dive into some specific cases that she has treated, exploring the root cause of tinnitus and sound sensitivities and how we can lead you towards a successful outcome. Dr. Diana, why does tinnitus and sound sensitivity matter to you?
From day one, I have noticed that these two conditions are not being treated properly in the clinic at large, right? People come in with these conditions and a lot of times they don't know where to turn because they aren't getting the right kind of resources. They aren't getting the right kind of information and strategies and management options. And so it matters to me because I've seen so many people struggle, and when they come and they're given proper help and they're given the proper resources to overcome tinnitus and sound sensitivity, they really can access and such they really can overcome this. They can regain their sense of control, they can regain quality of life. And it's important because we hear sounds every single day.
So, Dr. Dana, first with tinnitus, what are the common sounds that your patients hear when they reach out to you for help?
Sure. So it can be a variety of sounds. Oftentimes, patients will describe their tinnitus as a high-pitched, a ringing, buzzing, hissing. Sometimes people have described it as a cicada-like sound or a cricket-type sound. It can be a range of different sounds. It can also be multi-toned, so you can have different layers or combinations of sounds that somebody is hearing. But oftentimes it is more tonal, being high pitch or low pitch. That's a more common report. But again, it could be a variety of different sounds.
Yeah, I see that as well. And then the most common issues that patients tend to experience would be number one, falling asleep at night when it's very quiet, we're tired. Tinnitus is front and center. It's hard to shut it off. And during the daytime, there's also some other areas, right? So, what are the common activities or challenges that your patients see because of tinnitus in their lives?
I would say a lot of times it's lack of concentration, being able to focus away from the tinnitus and onto another task, right? So they might be trying to get through a work day and they can't because they can't focus on their work because the tinnitus is loud and intrusive.
I hear stories from my patients who say, Dr. Ben, I have no clue. How am I going to ever read again? I can't sit down on my couch and read a book right now.
Sure.
It's too quiet. My tinnitus is so loud. I mean, am I ever going to get better? They ask. And now eventually they do get better and they are able to read a book. And when I see that kind of 360 transformation, of I can't read it at all, now I'm back to reading and I never thought it was possible. Those are the stories that really light us up and inspire us to keep helping people with tinnitus. Um, and yeah, do you see that with your patients of, can't work, need to take time off of work, can't focus, fight or flight system activated, anxiety, stress, worry, fear, all these things that are really hard to deal with. But then months down the road, they're back working, they're feeling like themselves again. What is really possible here with tinnitus treatment from what you see with your patients?
We know that people can overcome it. And to see somebody that was struggling so much to be at a place where they're return they are living a good life, that they're not impacted by their tinnitus. That is why we do what we do.
If you're looking for the next step for your tinnitus, consider taking the tinnitus quiz. My team of doctors and I created this free online quiz where you can answer some questions and we'll provide next steps for your specific tinnitus case. We address issues like sleep, concentration, anxiety, sound sensitivity, all in an online free quiz. So head over to tinnitusquiz.com or click the link on the screen to get started. Now back to today's podcast. In your experience, what percentage of tinnitus patients also experience sound sensitivity or hyperacusis issues?
I would say about 20 to 30%. That's been in my clinical experience.
And what are the common symptoms or sound triggers that affect your patients with sound sensitivity issues?
It can be a variety of different sounds, but when somebody experiences sound sensitivity, oftentimes they are responding to what would be kind of normal, fairly innocuous type sounds. So it could be something as simple as a door closing or a door slamming, keys rustling or dropping onto the floor.
Now let's jump into your experience. So you had worked at a private practice in Long Island, New York, and then took some time at Weill Cornell Hospital in New York City, and then ended up owning a private practice on Long Island. So can you tell us about how specializing in tinnitus and hyperacusis affected your local communities and the kinds of patients that ended up seeing you and getting help?
Sure. So I always say tinnitus chose me. I didn't choose it. And to give you more context on that, when I graduated from graduate school, I landed my first job at this private practice on Long Island. And it happened to be a private practice that specialized in tinnitus, hyperacusis, and misophonia. Um, and starting right off the bat, I knew almost immediately that this was an underserved population of people. There were local ENTs, local audiologists, and actually people traveling from different states to come to this practice because of the expertise and the specialty. So, right off the bat, I knew that this was a population that needed more resources that they were not finding. And so I learned everything that I know about tinnitus in real time, right? In the clinic. I had not taken a class in tinnitus in graduate school. And so I really, through day to day in and out of working with these patients, gained a great sense of what tools were needed, what counseling strategies were needed, what sound therapy tools were out there to help these people.
Could you please just summarize some of the core principles that you learned of tinnitus retraining therapy and how that can help those listening?
So one of the core principles, one of the primary core principles is neurological conditioning. So TRT operates on the premise that tinnitus can become conditioned in the brain, leading to a perception of sound that is distressing. So the emotional brain interprets it as something that's negative, and it causes a series of kind of emotional responses, distress being a primary response. And the goal of TRT is to retrain the brain to reduce the emotional response to tinnitus. So neurological conditioning is a primary component of TRT. Oftentimes, it's through the use of ear level devices that produce sounds into the ears and helps to mingle with the sound of the tinnitus. By pairing the sound of the tinnitus with something that's more pleasant or neutral, it actually helps to retrain the brain into thinking differently about the tinnitus. So, neurological conditioning, sound therapy, and really the focus on counseling, demystification of the tinnitus is so important. Having people understand what their root cause of their tinnitus is also important, because it knowledge is power, and so being able to have more information about something that you are going through can be extremely helpful, for somebody who experiences tinnitus. And really, the main core principle is the focus on habituation, allowing somebody to experience their tinnitus with absolutely no emotional reaction at all.
I think that's great news for someone who's listening because they may have been told there's nothing they can do for tinnitus, yet you and I are sitting here trained in this method that has helped a lot of our patients bring tinnitus from, say, a level 8 down to a level 2, 8 out of 10, constant, severe, impacting their sleep, their waking hours, almost all parts of their life. They may hear it 80 or 90% of the day. With the right treatment, that can go down in many cases to say a 2 or a 3 out of 10, where the awareness of tinnitus is less than 20% of waking hours, where most often the volume perception has gone down over time. So even though that's not a cure completely eliminating it, that is an important message to share that there are treatments out there and they do apply to most people. What's generally your advice for patients who have had this condition that's been bothersome for them for a few months and they're starting to look for a professional treatment? What's your advice?
I think it's really important to look at all of the options and see which one is most appropriate for a patient. The research does show that when you pair sound therapy with counseling, that oftentimes the effects are um, more far-reaching in a positive way than if you were to do any one of these methods individually. And that's simply because of the retraining that takes place when you apply the sound therapy, but also work on how the brain is interpreting the tinnitus signal. Again, it's about appropriateness for each individual patient, but I can say that, but more often than not, people who start sound therapy and go through a program like ours, where you are pairing it with coaching and really individualized support, that those are the people who really overcome their tinnitus at a faster rate. And that's just simply because, we know that habituation may take place over time, but we are trying to speed that up for people because we know that this is very impactful. So, to your question about how would I address some of these other options with people, it's always important about education, finding out, what is most appropriate. If somebody does have a hearing loss, sometimes it is important and appropriate to intervene with hearing devices, hearing aids, in addition to using sound therapy, because their ears are looking for more sound. And that in and of itself may be really helpful in helping to reduce the sound of the tinnitus. So it really is individualized, but I will say that the pairing, the coupling of sound therapy with counseling, directive counseling, like what we do here, really yields the best outcome.
Something I've noticed in working with patients who have tinnitus is that a lot of them also experience sound sensitivity, but just frankly don't know that it had a name. The technical name for most sound sensitivity is called hyperacusis, and sounds like running water, dishes clanking, driving in a car, flushing a toilet, sometimes people's voices, loud sounds. Those can all trigger this loudness response, which we call hyperacusis. And for some patients, the hyperacusis can actually be more of a problem than tinnitus. So I wanted to ask you about your experience with sound sensitivity. Really, talk to us about what are the most important things that we should know. I'd like to learn a little more about how you approach sound sensitivity treatment with your patients.
Sure. So, one of the most important things about sound sensitivity is the understanding that it can present with tinnitus. It can also present on its own. The two conditions do not need to coexist. And so, when addressing sound sensitivity, there is some overlap to how we would address tinnitus. It is about utilizing sound therapy, but the crux of it is to help somebody kind of reorient back into the real world without experiencing the trigger sounds in quite the same way. And so we would apply sound therapy, and actually, it's a very successful treatment option for people who have hyperacusis. And the sound therapy allows them to not only experience the world in a way that is less triggering for them, but also it helps them to kind of recondition their response to those triggering sounds, because with hyperacusis, there's a physical element to it, right? The sound itself is uncomfortable, but then there's an emotional element. So it is their emotional response to their specific triggers. And so it follows the same with tinnitus to some extent, but sound therapy oftentimes is an appropriate option, again, with directive counseling, so that they understand what's happening. They understand how they can mitigate some of their emotional response when they're triggered. And yeah, it's also a process. When it presents with tinnitus, oftentimes we try to treat the hyperacusis first. That is as Dr. Jasterboff under the TRT approach would suggest, is treat the hyperacusis first. It is oftentimes the first to resolve, and then go ahead and do more targeted treatment for the tinnitus.
Now, Dr. Dana, tell us about some case studies that were notable for you.
Yeah, I'm thinking of one woman individual. She was in her 50s. She had gone to Europe with her family. She was super excited about this vacation. I had seen her previously just as a for hearing tests, nothing specific going on, but she had gone and she attended a concert there and without earplugs. And almost instantaneously after the concert ended, she experienced what we would consider to be a temporary threshold shift. What she described it as clogging in her ears. She had ringing in her ears. Really kind of expected it to go away, and it never went away. But the bigger issue for her was sound sensitivity. She was really struggling with being sensitive to sounds that she had not previously been sensitive to. And it changed, of course, it impacted her whole vacation. This happened earlier on in the vacation, and so she was kind of struggling to get used to it. She was having a really tough time. When she returned home, she saw me probably within the 3 to 4 weeks after the onset of the tinnitus and the hypersensitivity. And again, the tinnitus was not really bothersome for her. It was more the fact that she could not be in different environments with her family. If she had a family gathering, she would actually have to go into her bedroom because she could not tolerate even having 3 or 4 people having a conversation around the dinner table. So it was really distressing to her. She is a family-oriented person. She loved to entertain, and so this was a complete change to her quality of life. And so I intervened very quickly with sound therapy over the course of probably about 6 to 7 months is how when I saw her. And slowly, she started to be able to experience different environments with less discomfort. And to your point, she didn't always notice it. She would come in and she'd say, I'm still really bothered, but she would also tell me, hey, I was able to go to this restaurant. And I would say, "Hey, you weren't able to do that in the beginning." So it's a testament to, us being on this side and being able to guide somebody and also point out their successes when it may not be as obvious to them. But ultimately, she was able to stop using her sound therapy and she was able to kind of start experiencing sounds as they normally were. The tinnitus never went away, but thankfully it was not bothersome for her.
And then you had one more case study here with misophonia, which is a certain type of sound sensitivity. Could we hear a little bit about that?
Yeah, so just a quick definition of misophonia, which is adverse emotional reactions that arise in response to specific patterns of sounds. Oftentimes they are mouth-based sounds, so chewing, lip smacking, swallowing, slurping are some examples. This was a 13-year-old boy. He was a student struggling with misophonia. And as you can imagine, a lot of those sounds we hear a lot throughout the course of the day. And for somebody with misophonia, it's oftentimes a struggle in school because they're hearing these sounds in contrast to a fairly quiet classroom setting. And so he was really struggling to get through the day, difficulty focusing, difficulty test taking. He had to take frequent breaks, and it was really distressing for him. He was bottling up a lot of this emotional energy and really having a tough time when he got home. So we did intervene with sound therapy, which gave him a really nice kind of buffer of sound throughout the course of the day. So he was still hearing his triggers, but they were much less noticeable, which means his fight or flight response was not nearly as engaged as it had been. So he was not as apprehensive about going to school. He was able to get through the school day with much more ease. And so it was a perfect example of how sound therapy could be successful for misophonia as well.
Perfect. Thank you so much. That really highlights the great work that you do with patients, sound sensitivity, tinnitus, etc. Guys, if you'd like to work with Dr. Diana Vetere, you can head over to treblehealth.com and schedule a consultation to learn more about the different solutions that might be the right fit for you. Ultimately, a personalized approach which understands the individual patient and gives the right treatment based on what you need is our recommendation, and we provide that over Zoom and telehealth. So you can click a link right there on the screen to schedule a call today, and our team will take the next steps and be able to guide you towards relief or improvement. Dr. Diana, thank you so much for being here and joining Treble Health. I am really excited to work with you for years to come and help the millions of people who with tinnitus and sound sensitivity issues.
Thank you. I'm grateful to be here.
Guys, it's Dr. Ben Thompson with Treble Health. I really appreciate you watching this podcast and being part of our community. If you'd like to speak with a specialist on our team, you can click the button on the screen right there, and we'll be able to help with a free Zoom consultation from the comfort of your home. There are specialists on our team that can help, so reach out, and we're here for you. Thanks so much.